My name is Dr. William Thomas Long of the Arthritis Institute at Good Samaritan Hospital in Los Angeles, California. The reason for shooting this video is to get information out to patients around the United States and the world regarding the failed Durom cup by Zimmer. The Durom cup is a portion of a total hip replacement system by Zimmer Corporation, which is associated with the loosening rate due to failure of bone ingrowth into the cup.
Hey, basically I started off with the original Zimmer Durom cup. For whatever reason, the right side, it did not take. Pretty much we didn't understand what the problem was until 2 years later. And what I was going through in those 2 years was an unbelievable amount of pain. I was not able to sleep. I was not able to get up and go use the restroom without hopping around on one leg. I needed a crutch or a cane or a walker just to do mundane routines in my house, like brush my teeth. I recommend that anyone that has any discomfort, explain it to your doctor in detailed fashion, because they won't understand exactly what you're talking about. When you say you have throbbing pain, let them know that it lasts for hours. When you say that you have a sharp shooting pain, try to describe exactly where that pain is. I did the best that I could, and fortunately I have a very great doctor, Dr. Long, William T. Long, and he was able to discover that the porous part of my implant was not connecting to the bone, which in my opinion was ridiculous, because for 2 years I had been in excruciating pain in asking that question. However, after 5 different doctors looked at different x-rays, it was Dr. Long's keen eye to discover that there was a space between where the cup and the porous material was supposed to unite. It never happened. The sharp pain that I was explaining on being descriptive where it is, I'm feeling that right now. I have not pinpointed exactly where the pain comes. It's like a lightning bolt. I don't know if it's in my leg, I don't know if it's in my hip, I don't know if it comes through my back, but it makes me feel like I have Tourette's because I make the noise. And that's for real. So when I'm with my mom, I'm embarrassed, or if I'm with the friends, I'm embarrassed because I know that I'm going to be in pain and make that noise. They're understanding, but I'm trying to locate where that pain is. I haven't discovered exactly where it is. Now the throbbing, I would sit up and feel the throbbing, just basically feeling like someone that's got a 200-pound bear grip, just holding onto your hip, and it's just pulling you in. So you need to be very distinct in telling them that don't just shake your head and agree with me in the pain process. Explain to me why I'm having this pain. And if they're not able to do that, then you need to go for a second opinion. And then you need to go for a third opinion. I actually went to maybe 5 different doctors before I found myself back at Dr. Long, who had the keen eye to spot that the growth from the bone was not, it was not touching the porous part of the implant.
One of the most frustrating and difficult problems with the failed Durom cup is difficulty in making the diagnosis early. The patient complains of startup pain, pain when rising from a chair, when entering or exiting a car, or when going from standing still to walking. None of the patients could walk half a mile or a mile without increasing and sometimes excruciating pain. Despite all of these clinical findings, the x-rays remain normal for up to 1 year after the failed operation. After 1 year, a dark line will form around the acetabular component, indicating failure of bone ingrowth. The purpose of this video is to facilitate an early diagnosis of a loose Durom cup. By identifying the loose cup early, it is possible to explore the hip and remove the Durom cup and exchange it for another acetabular component with an excellent track record of bone ingrowth. If you believe that you have the symptoms described by the patients in this video, please notify your treating orthopedic surgeon about your concerns, or contact us at the Arthritis Institute at Good Samaritan Hospital in Los Angeles, California. Thank you very much.